Hey guys, Jessica Willis here with Willis Advisory and Insurance, and we're continuing our 28-day posting challenge. We are in Health Insurance 101. If you haven't watched the other videos, please go back and watch them so you can play catch up with where we are at today. Today we are going to discuss what is a pre-existing condition and how your insurance company will cover a pre-existing condition. So obviously, people that have pre-existing conditions worry that if they switch to a new insurance provider, if that insurance provider will cover any pre-existing conditions. The truth of the matter is it depends on your insurance plan. Also knowing what counts as a pre-existing condition and how that insurance will handle it can help you avoid any unexpected surprises or unnecessary medical bills. So let's start with what a pre-existing condition is. A pre-existing condition is any health issue that you've had prior to enrolling in a new insurance plan. This could include chronic illnesses, past surgeries, ongoing treatment. It can also be a diagnosed condition or symptoms that suggest a condition. So some common examples of pre-existing condition: asthma, diabetes, high blood pressure, cancer, current or past, pregnancy, sleep apnea, any mental health conditions, depression, anxiety. Key takeaways: if you receive treatment or have been diagnosed or even show symptoms before enrolling in a healthcare plan, it could be considered a pre existing condition. Now, the big part: does health insurance cover pre-existing conditions? Well, if your plan falls under the Affordable Care Act, individual and employer plans, then yes, the health insurance companies cannot deny coverage or charge you higher premiums for any pre-existing condition. You cannot be denied treatment for any pre-existing conditions once covered, and there's no waiting periods for covering that pre-existing condition. Short-term plans or some employer plans may have some limitations or exclusions when it comes to a pre-existing condition. They may also have a waiting period for set treatment or prescriptions, and they can also charge a higher premium or deny coverage based off your medical history. Now, if you're on a Medicare or Medicaid plan, well, those fall under the same guidelines as the ACA, Affordable Care Act. So any pre-existing conditions will be covered and there are no waiting periods. The biggest difference there is that these programs are income-based programs. So you do have to apply and get approved for coverage. Big takeaway is if you have an ACA compliant plan, you're protected. But if you have a short term or a limited benefit plan or even some private plans, you may not be covered for your pre existing condition. Always read the fine print. Another question I get is pregnancy considered a pre existing condition? And yes, pregnancy is actually considered a pre existing condition, and some plans still have coverage restrictions when it comes to pregnancy. Now, your ACA compliance plans must cover pregnancy, childbirth, and newborn care, but some short-term, private, or employer plans may not cover pregnancy. So if you're planning to get pregnant, check with your plan's maternity coverage. If you have any questions, we're going to go into a deeper dive video regarding pregnancy and maternity in another video. So when do pre-existing conditions waiting periods apply? So some types of insurance policy use the waiting periods, meaning that you have to wait a set amount of time before coverage for that. So situations where waiting periods may apply: for your private, they may have a 6 to 12 month waiting period, meaning that they're not going to contribute or cover any medications, doctor visits for those pre-existing conditions after that waiting period or until that waiting period has passed. A pre-existing condition, if you are needing coverage right away for that pre-existing condition, medication, diagnostics, ongoing treatment, surgeries, hospital stays, then you need to have an ACA, an Affordable Care Act approved plan. If you're going to be looking at getting pregnant or currently pregnant, having an ACA approved plan is the best way to get that coverage with no waiting periods. If there is a waiting period for a pre-existing condition written in your plan, knowing those exact time frames and the details are going to be super important. Always check the fine print. All right, guys, that is it. I hope that this broke down what a pre-existing condition is and how insurance will cover those pre-existing conditions. It really is solely based off of what your policy is, the fine print, and how it is built. And safe bet is always to have an Affordable Care Act approved plan. That's going to meet the minimal essential coverage and give you all the benefits that you need without the waiting periods. Enjoyed this video and received some good information from here to help you when it comes to selecting a new policy or shopping for a future one. Follow along at Willis Talkin Insurance on YouTube, Facebook, and TikTok. And of course, if you want one-on-one time to review your current plan or shop for a new plan, you can book that time at willis.care. Y'all have a great day.